More than 30 doctors reported to AHPRA for not checking SafeScript, which is the Victoria version of ScriptCheck WA. Now, this is an article that was sent to us by the practice owners. And to be honest, anything that involves AHPRA and doctors reported will always pique my interest. So these doctors were reported to AHPRA because checking SafeScript is actually mandatory in Victoria whenever you are prescribing opioid medication, benzos, or other controlled drugs. And you can be fined up to $19,000 if you don't. Now, this ruling unfortunately came into place when a coroner was investigating the death of a 46-year-old who was prescribed a total of 988 tapentadol tablets and 1,785 oxycodone tablets in a 6-month period. Now, this triggered 77 red flags in SafeScript. And despite those red flags, it seems the doctors only checked SafeScript 6 times. And so I hope I have sufficiently scared you enough to watch the rest of this video, but I'm basically going to show you how to use ScriptCheck WA. And this is a completely free program. To access ScriptCheck WA, I'll leave a link in the description below, but you can also just Google ScriptCheck WA. This is actually the prescription shopping hotline, the telephone that you can call and speak to that person who will tell you whether this patient is on the list or not in the online form. So I think they will be effectively phasing out the prescription shopping telephone number, although when I last checked, it does still work. What's important to mention is it will monitor all Schedule 8 prescriptions, both on the PBS and privately, at the point of prescribing the medication and at the point of dispensing the medication. So both of those things will be pointed out for you. To get the ball rolling, you do have to register for ScriptCheck. I'm not going to show you how to do that. You basically just click on it and put in your details, and you have to put in your mobile number in as well. Every time you turn on ScriptCheck, you will get a text message that you have to put in to access the database. There are some bits here about ScriptCheck in general. There's also some information for consumers. Now, what's also interesting in this information for consumers is they have specifically asked whether your doctor or pharmacist needs permission to access ScriptCheck. And the answer is no. And so this is obviously different to My Health Record because you can't actually opt out of ScriptCheck. Now, the reason why I think this is so important is that the stats when it comes to fatal overdoses are absolutely terrifying. As you can see, in Western Australia, more people died from fatal overdoses from Schedule 8 drugs like opioids than through road traffic accidents. So it seems that we do have to start doing things to prevent these fatal overdoses from effectively prescription medication. Now, another thing that's important to point out here in terms of ScriptCheck is that it will not tell you whether or not to prescribe the medication for the patient that you are seeing. So that is effectively a clinical decision, and you can decide whether they are only seeing you for these prescriptions, whether you may have a contract, whether you're planning to wean the patient off these kind of medications. They're effectively often very difficult consultations. So personally, what I find is that the more information you have, the better. Now, this is particularly relevant if you are doing locum work. And I have a video that describes a little bit of why you would want to do some locum work. And I do locum work occasionally, and I find it very rewarding. But what I've noticed in the locum work that I do is that because patients don't know me, I get a lot of Schedule 8 requests from people that I've never actually seen. And so it is very often difficult to navigate those kind of consultations. And personally, what I find is the more information I have, the easier it will be for me to come up with a treatment plan for that patient. Now, if you want to access ScriptCheck, you pretty much just go down to working with ScriptCheck, and then you click on the online portal. At this point, you have to put in your username, which will often be your email address. You have to also put in your password. This is where you will get your verification code to your mobile phone. At this point, it will ask you to set up a PIN, and this is the ScriptCheck screen. Now, what you need to do here is put in the first name of the patient, the surname, and the date of birth. Now, I will give you an example here, and I will blank out all the details. Now, once you have put in the details of your patient, if that person has been prescribed a Schedule 8 drug or another controlled drug, then they will pop up here in the search results. Double click on the patient. On the left-hand side, you will have the date that the person has received a medication. You will have the medication that they have received, and you will have the prescribing doctor. Now, I am blurring out the details here for you, but unfortunately, it seems that every single one of these prescriptions is coming from a different practitioner. And it will also have the address of that practitioner, and it seems that those addresses are also different. So what that means is this patient is attending multiple different practices, and as you can see here, I'm going to unblur this bit, and it seems that she's getting higher and higher doses of that medication every single time. This unfortunately means that this patient is in a really difficult situation because it's possible that her body is getting dependent and her body is habituating to the medication. So what that means is she is needing a higher and higher dose to satisfy that craving that her body is getting for that medication. Now, we know as clinicians that opioid medications in things like chronic pain do not work and do not work well, and patients can end up getting a lot of side effects. And so part of our role as a clinician, as a GP, is to be able to firstly identify the patients that need that help, to wean off the opioid medication. And then secondly, if we are not their regular GP and we are just covering or doing a locum shift, to actually stop those prescriptions and just say, listen, I'm not your regular GP. Unfortunately, I cannot prescribe this medication for you. And sometimes I will actually let the patient know that there's a system of mandatory reporting when we do prescriptions of Schedule 8 drugs. And I can unfortunately see that a few days ago, she did get a prescription for 28 tablets of 150 milligrams. So sometimes that can open up that conversation and make the person realize that actually this isn't really sustainable, because she's going to be seeing more and more random doctors who have access to ScriptCheck and won't really be keen on perpetuating these prescriptions. There's no silver bullet here, and you're all clinicians because you have the skill set to be able to manage these situations. But this is a tool that's meant to help you with that. Now, I'll finally just mention that if you're still a little bit old-fashioned, you can also call Services Australia. The prescription shopping program, as far as I'm aware, is still working. And the way that you would do that is you would basically scroll down to Prescription Shopping Information Service, call the PSIS, and then click on the link here. And this is effectively the telephone number that allegedly works 24 hours a day, 7 days a week. Now, I hope that all makes sense. If you have any issues, just feel free to leave a comment below. Otherwise, good luck.